So your fingers could be locking, stiffness. Actually, it could be a very common issue. Hello everyone, I'm Joe Basichia. Glad to have with us Dr. Andrew Sattel. He's a hand surgeon at Virtua. Let's find out more about this, because certainly it could be many different other things, but a very common issue it can be is what?
Well, it is a very common condition where individuals come in and they attribute it perhaps to arthritis. They say, my finger, when I bend it, it gets stuck and then pops open. It's a common form of tendonitis, actually known as trigger finger.
So we're talking about a type of tendonitis. What does that mean?
Well, we have different tendons that move the fingers, that straighten the fingers, that bend the fingers. The flexor or bending fingers are the tendons that bend your fingers. And at the base of each finger, there is a ligament, actually known as a pulley, that crosses that tendon. And when that pulley becomes thickened, when the tendon bends, it can become stuck. Then when you bend the finger, instead of it smoothly opening, it gets stuck, sometimes requiring a manual manipulation to get it open again.
What causes that?
Well, with time, what can happen is that pulley that crosses the tendon becomes thickened. This is a very common condition, by the way, not necessarily secondary to type of injury or work activities. It just happens for no good reason, but it is a very annoying condition when your finger, after you bend it, gets stuck. And what we often do is we see people who have been going for weeks or even months without realizing that this is a very common and very easily treated condition.
So in other words, when that happens, don't feel like, hey, just ignore it and it may go away. You can actually get help with this. You can really get help with this.
Yes.
What do you do?
Well, individuals come in and they show you that when my finger bends, it gets stuck. What's going on here? Oftentimes, a simple, small little injection with a small dose of cortisone can have a significant impact on alleviating or even curing this condition. So I often offer that non-operative treatment first. If that doesn't work, there is a 10-minute outpatient procedure where, under local anesthesia, we numb up a small, not even 1-inch long incision, and that pulley is released. The gratifying thing about it is virtually minutes after this procedure, you can see the patient opening and closing the finger with no further locking. They're back to routine activities very quickly. Stitches are out within about 9 or 10 days, and you can pretty much get back to what you want to do quickly.
It's great to have you with us. He is Dr. Andrew Sattel. He's a hand surgeon at Virtua. To learn more about Dr. Sattel or any of the surgeons or physicians at Virtua, simply go to virtua.org.